Hello everyone, this is your host Rohan Tandel from InnoHealth Magazine Studio. I welcome you to this podcast produced by Innovation Curious with a mission to spread awareness and knowledge of various facets of healthcare innovation. You are listening to the Voices of InnoHealth podcast from InnoHealth Magazine, the first magazine in India on healthcare innovations. In this podcast, we invite various industry leaders and discuss their views on the healthcare industry and innovations. Today, we are going to have a conversation with Dr. Arjun Dang. Welcome, Dr. Arjun, to our podcast. How are you today, sir?
Hi, Rohan. It's an absolute pleasure to be here. And I'm so glad that we are managing to chat today and record this podcast. So, looking forward.
So, before starting, I would like you to tell us a little bit about your career path and your journey up to this point.
Sure. So, Rohan, I did my MBBS from Chennai down south, where I spent about 5 years for my MBBS, post which I did a MD in pathology. And post my MD pathology, I've worked in Indraprastha Apollo in New Delhi, where I worked in the Department of Histopathology. And post that, I also worked in Lady Harding Medical College in the Department of Specialized Hematology, post which I've done a fellowship in liver histopathology in King's College Hospital in London. And it was only 4.5 to 5 years back that I came back to Delhi from London. And that's the time that I joined Dr. Dang's lab. And I've been leading Dr. Dang's lab as CEO since the past couple of years.
That's a great and focused journey, sir. So, now moving further, talking about career, people utilize various resources available to them. So, I would like you to share some of the resources or books that you found enriching in general or focused on healthcare.
Sure. So actually, I think it's the age of convenience. And a lot of us these days just read books and online sources digitally on our phones, on our iPads. So I do follow the Ken very closely. And it also has a lot of resources for non-medical things as well. But it keeps you up to date with a lot of insights, even on the healthcare front. They have some great stories on the COVID-19 pandemic as well. Apart from this, my usual is the Lab Report podcast. If you want to be more diagnostics oriented, this is by Genova Labs that talks a lot about functional medicine testing as well. And if any of the people hearing this podcast really want to go out there and get some more in-depth knowledge about diagnostics, then Lab Report podcast is the best one out of them.
I'm sure it would help the people in this similar stream that you are in. And I guess it would benefit them a lot being able to experience or say gain knowledge from the experience that others have in the diagnostics field. So, moving to the next question, what I would like to know is what inspires you in your work? Any individuals you idealize and why?
So, Rohan, always I think anyone who's probably passionate about anything that they do, there is a driving force behind them actually sprinting towards the end goal. And I think the driving force for all doctors, and at least in the diagnostics field, is that actually to see a patient happy and the patient's family happy after getting diagnosed and probably treated is actually the best part of our entire service sector. So what I actually mean, and it was very, very relevant in COVID as well, that there was so much lack of awareness as well, and even speaking to patients on the phone, or even convincing them about not to panic, not to worry, or even show them next steps about going to a doctor or explaining the report or even the medication that they want. And then eventually, once they recover, the blessings that you get from them, and actually the goodwill that you generate with seeing a recovered patient. And actually, the best marketing also is by word of mouth. So I think all of these things in the long term actually inspire me a lot. And that's why my passion keeps growing to do better and give better to all our patients. And I think any individuals that I'd idolize, so yes, I would like to share here that the reason that I became a doctor and that I became a pathologist as well, is my late grandfather. He's no more with us, but he lived a full life up till the age of 98. And he was a doctor, and he always told me that, Arjun, if you want to do something in life, then you must become a doctor and you should do something for the community. So, yes, I have been motivated since I was a little child. And my dadu is the one who motivated me to reach this level.
It's great, sir. The legacy left behind. It's kind of, taking that responsibility is a big drive for many people in various industries. So yeah, that's a great inspiration, sir. So now, coming to the next question, when talking about innovation, the definition of innovation may be same for everyone, but the meaning, the value of the word, or say the inference that people take out from the word differs from person to person. So my question to you is, what does healthcare innovation mean to you?
Okay, so I think it's very interesting because if you ask several people, probably you'll get seven different definitions. So this will obviously be biased to my process of thinking. But Rohan, what I really feel about innovation is that there is a patient or a disease treatment paradigm in which healthcare works, and obviously healthcare workers try to be in that kind of environment where diseases are getting treated as soon as possible. So I think in the entire disease treatment paradigm, with the patient in the center of this paradigm, I feel if you come up with something that is novel, that is scalable, and adds value uh, to the patient, I think that is what is true healthcare innovation. And certainly, if you find something that might be novel, probably is adding value, but is not scalable, then I won't call it a successful healthcare innovation because it can't really be translated to the masses. So I think yes, all these three things. First is that it should have never been done before. That's what novel means. The second would be scalable, that it can be expanded across geographies effectively, and you can train people and make processes that can be replicated. And the third is obviously that you are adding value to the usual experience that the patient has in the disease treatment paradigm. So I think that is what I will look at healthcare innovation as.
Yeah, exactly, sir. Because innovation, the word innovation means that something that's born out of a need for something. So if it's not scalable or not reaching the masses, then there's no sense of it to be called as an innovation. So I guess that's a great perspective, that just not bringing something new to the table, but being able to make it reach to masses and not just making it some profit making business from it.
That's right.
So for the next question, so as we've been observing various trends in different industries during COVID, what I would like to ask is, how did the COVID pandemic change your perspective on healthcare, especially when it comes to innovation?
So very, very relevant question, Rohan. Actually, COVID has changed a lot of things, and certainly our perspective on healthcare, especially looking at times like the second surge of COVID-19 in a city like Delhi, when close to half of the city was infected. We actually realized and actually got to know the power of innovation and automation in order to handle large numbers. And obviously, the kind of volumes that were coming in, even if it was a simple RT-PCR test or even the blood test related to COVID-19, I think we saw a spike in a surge like never before. Actually, the interesting part, and I'm so glad that we are over that time, was that not only were the volumes tripling and quadrupling up, but also with half the city infected, a majority of our staff was also taking turns to get infected. And I think that's the time when innovation was key, when actually the training of your staff members was very important, and also how to triage and prioritize which areas needed the qualified people, I think was very, very interesting. And I'm so glad that we managed to get through it. But yes, the main change in perspective was that you have to act with presence of mind, and you do need to improvise on a daily basis, not only to troubleshoot, but also to optimize your processes and streamline your entire workflow.
Moving to the next question, among all the innovations we observed in the past couple of years, Would you like to highlight some innovations that you saw during those years that you find promising?
Sure. So, Ron, actually, there have been a lot of innovations, and there are young scientists all over the world that are constantly working on bringing new things. But I do see a lot of things happening in the West that probably are not yet been started in India, and more related to COVID-19 also, and obviously so because most of last year has been COVID. And I would say that a lot of saliva-based testing for COVID 19 that's being done successfully in the US. Now, we do have some rapid antigen kits that are approved by ICMR India, but currently there is absolutely no protocol, SOP, advisory, guideline, or ICMR approved kit for RT-PCR testing from saliva samples. Now, when you look at a country like the US that had a huge surge, that has a huge population, and also a good medical infrastructure, and I would say even India has ramped up its diagnostics and testing infrastructure. I feel the entire process of a phlebotomist or a technician actually having to collect the sample and then the sample having being sent to the lab, post which it goes for testing. I think if we can validate certain kits on saliva based testing, not only will it help us increase throughput from a lab's perspective, but also significantly help cut down on the use of extra PPE that is used to collect the sample. And also, it will certainly motivate a lot of people if they're just being tested on their saliva instead of getting the very uncomfortable procedure of a oropharyngeal and nasopharyngeal swab. So, yes, I wish there's another wave doesn't come in Delhi and India. But if it is, I just hope that this innovation of saliva based testing can somehow be implemented in our country.
True, sir. I would agree on that point. Current testing measures are quite drastic, I guess. Many people don't agree with this kind of testing or say are comfortable with this testing. So I would say that in regions that are, I would say about the region that I stay in, it's quite confined and people don't agree or say are comfortable with this testing. So they kind of use locally available medicines and they kind of try to sort out the situation by themselves. So if the situation changes, then it would far more be helpful, and
Definitely.
the containment of COVID can be better approached.
Surely.
So now, further talking about innovations, among all the innovations we talked about, there would be some innovations that you might have worked through the years. So what I would like to ask is, would you like to share your own work linked to healthcare innovation?
Sure. So, Rohan, again, thanks for that question. And actually, it was a result of the hard work of our entire team at our lab at Dr. Dang's in Delhi. And obviously, the guidance of my seniors and mentors. But we did manage to start and set up India's first COVID-19 RT-PCR testing drive through way back in April last year. And we actually have more than a few drive-throughs that are functional in the city of Delhi now. And actually it helped us a lot in increasing the number of samples that we were being able to collect in a day, and more importantly to minimize interaction and maximize safety with the patient sitting inside their car and just a hand coming in and swabbing you with a fresh PP and in maintaining all infection control protocols with only sign language that was being used in the drive-through. I think it was a phenomenal success. And I still remember that we've also done more than a couple thousand drive-through collections just in Delhi during the second wave. And more importantly, the feedback from the patients was brilliant. They were super happy that it happened within a few seconds. And even with our drive-throughs, till date, we've always given out reports within 12 hours. So it really helps the turnaround time as well, the convenience, and also the safety that was expressed by the patients who went through these reports with online payments and reports on WhatsApps and emails. I think we tried our level best to make it completely paperless so that there is absolutely no chance of any transmission by contact. And I'm really happy to see that although we started last year in April, and we were the first ones and we were the only ones operating it for the first couple of months, but now I see that there are probably a couple dozen drive-throughs that have come up in Delhi and NCR, and I think it's great because it is the most convenient and safe way for a patient to give their RT-PCR seamlessly.
Yeah, sir, it's quite beneficial for the patients as well as doctors. And from a broader perspective, I would say that it would leave a less carbon footprint too, because paperless, as you are going paperless for the documentations and all. So I guess it's a great initiative, sir. So talking about healthcare industry, for my final question, I would like to ask, what is the one thing that you wish we could change in Indian healthcare in the future?
Sure. So actually, Rohan, I can talk about this question for hours and hours because obviously the other side of the fence is always greener. And we look at the Western countries and other countries, and obviously feel that wow, healthcare is so great there. But the truth of the matter is that definitely India has taken giant leaps when it comes to consolidating healthcare, at least in the metropolitan and the tier one cities. And obviously, in the years to come, we must focus on last mile delivery. We must focus on tier two, tier three cities and the rural areas also, where there is desperate need of consolidation, there's desperate need of high-end medical infrastructure, and obviously a higher allocation from a government's perspective for funds also in this tier 2 and tier 3 cities. But from a bird's eye point of view, if I have to say three things that I wish and aspire that we can change in our country in probably the decade to come, would be that the first and most important one would be that I wish that the different physicians, the different specialists, and the different players in the entire paradigm of healthcare workers or healthcare in our country, I wish they do not work in silos, and that there is more effective communication among them that can lead to integrated healthcare and actually improved outcomes. What I mean by that is that currently, when there's a patient and probably they have a particular issue or have symptoms of something, then first they go to a doctor, then the doctor writes a prescription, then they go to a pharmacy, they get medicines, then they go to a lab to get some tests done, post which they go to a hospital, then the hospital, if required, gives them an admission, and then they are in the hospital. Then again, the entire circle goes on. So to make it more integrated in a way where you have all the services in one place, where the convenience is maximum for the patient, and keeping in mind that the patient is himself unwell, I would certainly say that integration in the entire healthcare sector is something that is really lacking. And I think it's small baby steps, but I do wish and hope that we finally reach it. The second one would be, Rohan, that actually very easy to say but difficult to actually implement, is that I see a lot of entrepreneurs, a lot of large industry players always going after volumes. It's always about the top line. It's always about what are the number of patients and the number of admissions and the number of tests. I think healthcare should also be counted in terms of not just numbers, but and not just volumes, but also value. What is the value that you've actually provided to a patient? Have you really affected the patient outcome in a way that is unparalleled? So yes, value over volumes would be the second one. And the third, obviously, and something again that I was always taught by my late grandfather, who was my inspiration, who I was speaking about earlier, was that quality is paramount. Quality is something that every healthcare industry and every healthcare person will strive to achieve. But I think there's always a requirement for a pinch of empathy with quality. And as much as possible, to give that shoulder to a patient to actually express and relate to you, so that you can communicate them the most effective way of treating their disease or managing their problem. I think empathy is certainly something that all of us together need to work on, along with giving the best quality.
Those are some great points, sir. From generalized point of view, many people say that implementation from other countries means the similar healthcare facilities would enable our country's infrastructure to develop, but it's not so easy. And you kind of precisely pointed out in various points. So it was quite brilliant of you, sir. And I hope that those points that you said would slowly but kind of get implemented to our healthcare infrastructure of our nation. So before closing, I would like to ask, where can our listeners connect with you?
Rohan, I'll be more than happy to connect with the listeners over email, and also they can add me on LinkedIn. And my email is drarjundang@drdangsLab.com. So I'll be more than happy to connect with them either on LinkedIn or my mail.
The link to connect with our guest speaker, Dr. Arjun Dang, will be down in the description. Before concluding, I would like to thank Dr. Arjun Dang for joining us and sharing your perspective. It was a pleasure having a conversation with you, sir, and it was an enriching experience too. Thank you, sir.
Thank you. Thank you, Rohan. Thank you for having me. It's been a great pleasure.
To conclude, I would like to call out to our audience to leave a comment with a review and let us know whether you like the podcast. Drop down a comment if you have any podcast ideas or recommendations. If you have a healthcare innovation journey of your own, do connect with us. And for more such content on healthcare and innovation, visit innohealthmagazine.com. Stay safe. Goodbye from your host Rohan Tandel from InnoHealth Magazine Studio. Thank you.
Thank you. Bye, Rohan.